everyone, and welcome to the podcast by Bio for Health. I'm Dr. Stuti Kaur, and today we're diving into a health topic which is far more common than you can realize: deep vein thrombosis or DVT. You may know DVT as just a blood clot in the leg, but when this blood clot travels up to your lungs, we have a condition called pulmonary embolism. Now, when you pair DVT with its dangerous cousin, the pulmonary embolism, we have a condition that's called VTE. Now, you may want to know what VTE is. It's venous thromboembolism, which is a potentially life-threatening situation. But what's more concerning is that a global study across 30 countries, including India, where you and I are living in, was found that over half of the patients who are admitted to hospitals for their critical care are at risk. In fact, for every 10,000 patients who are admitted to hospitals in our country, we have 17 patients who will face the complications of VTE. It's a significant number, isn't it? It is definitely one of the biggest hidden risk factors in hospital care today. And despite this, the concept of DVT remains unrecognized most of the times, which is why this conversation today is extremely important. And to break it down for us and to share expert insights on this crucial topic, we have with us Dr. Dhanesh Kamerkar, who's Professor and Head of Department at Vascular and Endovascular Surgery Department, Ruby Hall Clinic, Pune. We have Dr. Nupur Bhet, Consultant Vascular and Endovascular Surgeon, Ruby Hall Clinic, Pune. And we have Dr. Amit Rane, Consultant Vascular and Endovascular Surgeon, Ruby Hall Clinic, Pune. Welcome, doctors.
Thank you.
I'm so glad you could join us today on this podcast. So, let's dive right into the basics. Dr. Kamerkar, most people are not familiar with this topic of DVT. So, could you please explain to our viewers what exactly is DVT and why is it such a serious condition that we're addressing today?
So, DVT or deep vein thrombosis, as we all know, is developing clot in the veins of the legs. Sometimes they can also form in the veins of the tummy.
Right.
But what's really important is that many times these are silent presentations and people just get swelling of the legs, but there is no pain most of the time, and which is why it goes unnoticed. And at times, if these clots travel to the lungs, they give a big clot in the lungs, and that can be life-threatening, what we call as a pulmonary embolism.
That's right.
And these are the acute stages of deep vein thrombosis, so it has to be basically recognized early. Any swelling in the legs should not be ignored and should be looked into and investigated. And it's a life-threatening cousin, as you mentioned, can be because of pulmonary embolism.
Right.
But this is in acute cases of deep vein thrombosis, or what we call as clot in the legs. But when they become chronic or long-standing clots in the leg veins, they can basically present with severe leg swelling, severe pigmentation, severe hardening of the legs, blackening of the legs, ulcers developing on the legs, and sometimes they can have a recurrence of clots in the legs, and which again are very difficult to treat. Especially in a younger population, if you get these chronic deep vein thrombosis problems, then they can have issues in their occupational, or many times when these people have a long-standing jobs, they can develop these leg swellings and ulcers, and which are really difficult to treat, although they're not impossible, but difficult to treat. And it can take away their work hours, and many times people have to leave their jobs. So
right.
It's extremely important to treat these acute deep vein thrombosis in time and adequately, and again prevent those clots going into the lungs, which can be life-threatening. So it's very important to treat these patients and detect these patients of deep vein thrombosis very early and treat.
Right. So basically, from what you said, it means that it can disrupt your work-life balance, which is why it's a serious condition.
In a chronic stage, yes. But it's important to notice the acuteness of this deep vein thrombosis in early stages, because any leg swelling should be investigated for that. Otherwise, sometimes if you miss the boat, some patients may land up in ICU with a severe clot in the lungs.
Right. Now, this brings me to my next question, which is to Dr. Nupur. Who do you think is most at risk or vulnerable to developing DVT? And also, like, which are the common causes of DVT, which sometimes may get overlooked?
Okay, so to answer that question, deep vein thrombosis occurs most of the time following an episode of dehydration. So for people who decide to undertake an unaccustomed exertion, and if they haven't drunk enough water and hydrated themselves correctly, then they are quite at risk for developing deep vein thrombosis. Also, most of the times after a surgery or an accident or a fracture, when they have episodes of prolonged immobilization where they are unable to get up and walk, that is a period of extreme vulnerability, and that's when they can develop like clots.
Right.
Also, then again, in patients, in women who during pregnancy and in the postpartum period. So that is when ladies are at a highest risk of developing deep vein thrombosis. Also, patients, especially women, on oral contraceptive pills or hormonal treatment or during fertility treatment or taking treatment for PCOS, if the medications are not taken as per prescription of the expert, sometimes they can increase the risk of developing deep vein clots.
Right. And when you said trauma, it could be cases where your leg is in a cast and there's not much movement, or the patient is lying in bed for a long time. So that could also cause.
Yes.
Right. Any other major causes?
Two other major causes are when patients with cancer. So the cancer itself, and also the treatment in chemotherapy because of dehydration, or after the surgical treatment which has been done, then again the risk of thrombosis increases. So cancer patients are definitely at a much higher risk of developing clots than the other patients. Then there is a certain subset of patients where there is a genetic history or there is inherited thrombophilia group of disorders.
Okay.
They are also at a higher risk.
All right.
So most common cause will be dehydration. Sometimes it's contributed by alcohol binge or unaccustomed exertion. And then will be post-operative immobilization or immobilization following a medical illness like fever and diarrhea, and after that they got dehydrated and were unable to walk. That itself is a risk. Then come the women with pregnancy, postpartum period, and all the medications that can contribute. Then cancer, then thrombophilia.
Right. So a lot of partying can also be quite dangerous, causing DVT. Another thing that you emphasized on was cancer. Dr. Kamerkar, would you like to emphasize or elaborate more on that?
So, cancer or malignancies, wherever it could be in the body, itself is a prothrombotic condition. Whenever you have a cancer, there's a lot of genetic mutations.
Sorry, let me interrupt you. Prothrombotic, for our viewers, can you explain that?
So, basically, it's a condition where you tend to develop clotting or thrombosis. It can be in the veins, it can be in the arteries also, but more commonly in the veins as compared to arteries, clots in the arteries. And being a cancer, and it's a prothrombotic stage, you tend to develop this deep vein thrombosis. Also, a lot of patients are on the chemotherapy after the surgery or before surgery. And these also can cause thrombosis because of the dehydration following chemotherapy, because many of these patients develop vomiting because of chemotherapy. Also, chemotherapy itself has such strong drugs also can be prothrombotic. So, in cancer, the condition or the disease itself being prothrombotic, and its therapy or treatment also can be prothrombotic. Third thing is, many of these patients, when they have a chemotherapeutic drugs, they have a kind of pump cath or a line in their neck veins.
Right.
And because of recurrent use of chemotherapeutic drugs, they also can develop thrombosis in that line or around that vein. And again, why it is dangerous? Because those veins, although they are in the upper limbs or in the neck veins, they can easily migrate to the lungs if they develop clots. So again, that's critical to know also. So all these three conditions or three phases in cancer therapy and cancer treatment are more prone to develop deep vein thrombosis. And many of these patients nowadays we advocate blood thinning tablets or anticoagulation for these patients as well. And it is also been seen that especially patients with advanced cancer, this kind of blood thinning is advocated till the time the cancer disease is active.
Right. So also, can we say that unexplained blood clots could be like a sign of cancer?
Yes. So when somebody presents to us with the deep vein thrombosis and we cannot find out an obvious provocating factor, especially in a middle-aged patient, even sometimes even in young, when we cannot find any thrombophilic, meaning the deficiencies in the blood parameters, then we do suspect malignancies or cancers in these patients, and the best way to identify these is doing a PET scan, which can pick up any hidden or occult cancer anywhere in the body. So, but of course, after ruling out your major common provocating factors.
True. I think that's a very vital information because our viewers would definitely like to know the relation between cancer and DVT. My next question is to you, Dr. Amit. What are the early signs and symptoms of DVT, or how would a patient know that he's suffering from DVT?
That's an important question, and all of the population should know the early flagship signs which can tell that they are suffering from DVT.
Right.
So when acute DVT happens, it is not limited to lower extremities only. So any extremity, upper limb or lower limb, if they develop sudden onset of swelling, which is associated with pain, or the pain is there on exertion along with swelling, followed by dyspnea or breathlessness on exertion, these are the early signs of deep venous thrombosis. If it is considered acute DVT, these are the symptoms. Whereas if we consider at a chronic DVT point of view, the recurrent ulcers, non-healing ulcers, continuous clear oozing from the ulcer, heaviness in the legs on prolonged standings, visible varicosities, visibly dilated veins, these would be the signs and symptoms for chronic deep venous thrombosis.
So basically your emphasis was on the word sudden. So there are things we need to be aware of, like considering the causes which Dr. Nupur mentioned and then correlating the symptoms, like you said.
Yes, correct. So sudden means whenever somebody has traveled for long duration, they have suffered from illnesses like vomiting, diarrhea or dehydration, or after trauma, immediately if they show this kind of symptoms, it may be the acute deep venous thrombosis.
Okay. So thanks for clarifying that. Dr. Nupur, sometimes it so happens that when a patient comes to your OPD with suspected DVT and these symptoms that we just mentioned, could it be that they come after a few days, say 2-3 days or a week also, there is already a delayed presentation? So what could be the consequences of ignoring the symptoms of DVT?
Okay, so there are lots of instances when patients present late and they haven't realized that there's something so sinister as a DVT has happened. So they will, most of the time they will ignore it as a leg sprain or a leg twist and the swelling, attribute the swelling to that.
I think that's more commonly heard of. It's just a sprain, it will go away.
So they will go to their general practitioner, sometimes even an orthopedics, and the first thing that they will think of is like a sprain, or they will do an X-ray which will be normal, and nobody will think of deep vein thrombosis in the 1 or 2 days or 3 days, sometimes even 2 weeks, people won't realize. So when these patients keep walking despite having these clots and not being on the correct medications, the clot can get dislodged and then it can go into the lungs and cause pulmonary embolism, which can be fatal. So that is why all this emphasis on recognizing the early signs so that you can prevent all the life-threatening consequences of pulmonary embolism.
Okay, so it's basically not just recovering from DVT, but it's also like saving your own life by coming on time and recognizing and being aware of the symptoms.
Yes.
Okay.
Amit, you want to add something to this?
Yes, definitely. When there is a ignorance in this part, it can pay at a larger price. So it is always better to be vigilant about deep venous thrombosis, and you should suspect that when you are not healing with those kinds of symptoms.
Okay. So when you see a patient is a suspected case of DVT, what should they do? Like the immediate step that they should take, who should they go to? Because I think many a times people don't know which specialty to go to or who to go to and could be misled in the process.
Whenever suspected, the patients should visit the vascular surgeon nearest to them. In remote areas, there is no specialty existed such as vascular specialty. In that case, they may visit their nearest consultant, who can in turn speak to the vascular surgeon in the nearest town, get the condition evaluated and take earliest measures. First thing first, whenever such kinds of symptoms are seen, The preventive measures for not worsening is not to mobilize earlier, go to the nearest physician and get themselves evaluated with necessary investigation, and the early treatment should be started at those clinics.
Okay. So usually we see that many of them nowadays resort to home remedies like massages, or maybe they'll want to apply something on their legs, or maybe use hot water bags or something like that. So what are your thoughts on that? How would you tell them not to do it?
Exactly, that's a very important question. All the patients who develop such kind of symptoms in terms of swelling and pain, massage is one thing that they should definitely not do.
Okay.
The reason is, if there are clots and it is a acuteness of the symptom, the clots may get dislodged and lodge into the pulmonary circulation, causing the pulmonary embolism. So massage is a big no for all these patients.
Okay, so now we have a brief idea what exactly DVT is and who is at risk and what are the common causes of it, what are the signs and symptoms of it, which brings us to an important segment. Dr. Kamerkar, I would direct this question to you. How would a doctor diagnose a case of DVT?
First, it's important thing is a clinical diagnosis. Anybody coming with a leg swelling, which is sudden, and many times, although Dr. Amit said with pain, but many times there is no pain, but just a leg swelling.
Correct.
And so clinical suspicion for that clinician is extremely important to suspect could be an acute deep vein thrombosis. And of course, clinical suspicion, sometimes you can have a tenderness or on the muscles or calves, or the entire leg is swollen, red. So these are the clinical suspicions. It has to be confirmed by doing an investigations, and the commonest and which is available everywhere, including the taluka places today, is a color Doppler of the leg veins, and that should basically pick up acute deep vein thrombosis. Sometimes if you suspect clinically, but you may not have a color Doppler nearby, just doing a simple blood test like a D-dimer, and if the D-dimer levels are high, and if you have a clinical suspicion, many a times it's acute deep vein thrombosis unless proven otherwise.
Right.
And then you obviously you can get color Doppler, but by this combination of clinical suspicion and a high D-dimer itself can basically prompt you to start blood thinning injections straight away, and then color Doppler you can get it done as and when early as much as possible. Many times the deep vein thrombosis can go into the big veins, into the abdomen, and also in the main vein which takes the blood to the heart, and that may not be able to pick up on a color Doppler.
Okay.
In which case you may get a MR venography or a CT venography, which is like doing a CT scan, and which would tell you the extent of the clot into the main veins in the tummy, as well as into the main vein, what we call as inferior vena cava, which takes blood straight to the heart and lungs. Now the importance of this is that in any of these, if you're trying to do any intervention like putting in a filter into the big vein to trap these clots, then you should know whether it is possible or not by doing a CT venography.
Right.
But by and large, clinical suspicion, color Doppler, D-dimer, and sometimes CT venography also will tell you. The other thing also, in order to find out whether these clots have gone to the lungs, then it is also equally important to do 2D echocardiography of heart to see whether the pressure in the lungs have gone up, because that could show the suspicion of clot in the lungs. And what we also, when we are doing a CT venography, we also do CT pulmonary angio, CTPA, and see, both these combined CT scan will tell us extent of clot into the big veins, also whether they have gone and broken down into the lung circulation. So these are the kind of test investigations which should cover majority of the things. Now, in some of the unprovoked deep vein thrombosis, especially in young patients who come to us, before we start any of this anticoagulation, and when we suspect that there could be a familial deep vein thrombosis or unprovoked deep vein thrombosis,
right,
where we suspect thrombophilic problems, we have to do some blood tests to find out any deficiencies of those clotting factors into the blood, so that before we start the blood thinning, because once we start blood thinning, these reports can interfere with that. So it's again a clinical suspicion. Somebody young coming to you with acute deep vein thrombosis, and you suspect that it could be having thrombophilic, it's better to send the bloods before that.
So I have a question for you. It's great that you mentioned about the D-dimer. It's important in places, remote areas which may not have the Doppler test. But in cases where someone might have DVT, but like you said, there may not be pain in all cases, what if the patient also has developed a pulmonary embolism? What could be a symptom?
So many a times patients can come only with breathlessness.
Right.
And if you find or examine the legs, there may not be noticeable swelling, because whatever clots have formed in the leg veins have already gone up and causing acute breathlessness and acute pulmonary embolism. In fact, there is a protocol. All these patients with a sudden breathlessness going to any casualty in the hospital, first thing is done is ECG to rule out any heart attack or myocardial infarction.
Yeah.
If that's ruled out, then the next test is to do CTPA, CT pulmonary angio, to rule out pulmonary embolism.
Okay.
And the same CT scan also will tell you at times if there is a condition called as a aortic dissection. So acute breathlessness going to the casualty, that's the protocol algorithm. Generally, majority of the casualties will and would and should follow, because this sudden breathlessness can be either of these three.
Right. Thank you for clarifying that for us. You may have, not may have, but I know for sure that you've treated a lot of DVT patients. And what is the treatment part of it, and how long does a treatment take for a DVT to resolve? Is it same for all patients, or does it vary?
So first and foremost is the moment you have a clot in the legs, you have to get those or prevent those clots going up into the lungs.
Right.
And for that you need a blood thinning treatment right away. Now blood thinning treatment starts with giving blood thinning injections to begin with in majority of the patients, like heparin or low molecular weight heparin, and these are basically injections available everywhere, including in the smallest place in taluka or even a village. And then you also nowadays have what is called as a new oral anticoagulants or oral drugs, blood thinning tablets like rivaroxaban or apixaban, so these drugs also can be given as a blood thinning treatment, essentially to keep the blood thin and prevent any clots going up into the lungs.
Right.
Now the action of these drugs, whether it's injections or this thing, is it causes the increased adherence of this clot to the vein wall. That is how it prevents the clots going into the lungs. Now the minimum treatment for these blood thinning tablets is minimum 3 months, and that's generally given in patients who have a provoked or the obvious cause to develop acute deep vein thrombosis, like fracture, or somebody is bedridden, somebody is paraplegic, or after head injuries they lie in the bed. And these are the patients, minimum 3 months you need an anticoagulation or a blood thinning tablets or tablets. But they are basically preceded with injections in acute phase. And many of these patients then go on to the oral drugs, which can go on for 3 months. Again, depending on the cause, the further extension of this blood thinning depends from patient to patient. And it can go on even up to some of the patient 2 to 5 years, because risk of recurrent clots in first 5 years is almost up to 24-25%. And so one has to gauge as to what is the risk of recurrence of DVT in your individual patient. But it basically from 6 months to 2 years to 5 years duration, depending on patient's cause of DVT is important.
Right.
So that's the key. Along with your blood thinning, you also would need compression stockings to keep the leg swelling control. Along with that, a good hydration is mandatory of all these patients, unless your cardiac pressures are very high, PA pressures, then obviously you have to limit your hydration. But by and large, majority of these patients need a good hydration. Now, another misnomer or myth is that somebody has an acute deep vein thrombosis, you should stay in the bed. That's
Right.
totally wrong. The moment you have diagnosed acute deep vein thrombosis and the moment you start adequate blood thinning treatment like injections or tablets, they should be mobilized. The more they stay in the bed, the more risk of that clot getting worse and going into the lungs. So they should be mobilized under observation, under supervision, preferably in ICU setup. The moment you start adequate anticoagulation or adequate blood thinning.
Right. I think that's very important because usually what people think is that, okay, if something has affected my legs, then I should not move, or what will happen if I do that. But I think it's important that you mentioned that mobility is extremely crucial in this. Also, how do you think is the compliance of patients when it comes to stockings or taking these medicines for so long? Because I think from whatever you said, it shows patience in the treatment of DVT.
So education is the key here. Educating your patients is most important right from day one.
Right.
That you need to explain to them what is their problem, what can be the fatality in this, what is the gravity of situation, and what is the treatment we are giving, blood thinning, and again for what duration we need to continue that.
Right.
Because many a times we have seen that patients stop the treatment on their own after 3 months and they come back with recurrent deep vein thrombosis. And as I said, the recurrence is in first 5 years is pretty significant, and which is why educating your patients is important. Second thing is many a times patients do not get a follow-up dates and they finish off their medicine. It is equally important to tell them that you need to continue these blood thinning tablets till you see your consultant or specialist again,
Right.
and he would decide whether to stop or not.
Correct.
Now the other side, because these tablets or blood thinnings are double-edged weapons, the other side of making blood thinner is bleeding. So some of these patients can have a bleeding complications, and because of the bleeding, they can stop their tablets immaturely before the treatment is completed. And if they stop, there is a risk of deep vein thrombosis again. So in case any of these patients have bleeding complications because of your therapy or blood thinning tablets, they should inform their doctors immediately.
Right.
Because some of these drugs are really potent, and what we as a consultant do is they stop their medicines, assess what is the cause of the bleeding,
Right.
and if it is not a major cause, then we generally would continue that or switch over to injections again and switch back or put them on another anticoagulant drugs. But just stopping completely is not right. Inform your consultants that if somebody develops a bleeding complication, report immediately so that that consultant can take care of the alternative therapy.
Thank you for highlighting those points for us. For our viewers, do not self-medicate, and if at all you have any symptoms like bleeding from anywhere when you're on these blood thinners, kindly consult your vascular surgeon ASAP. Now, when it comes to educating the patients, Dr. Nupur, what practical advice would you give to our patients and something like do's and don'ts for them to follow?
Okay, so when it comes to when we suspect DVT or you suspect that it's that more than a regular muscle sprain, first thing to do is to hydrate and not to walk around too much. So don't keep actively walking or exercising despite the pain. Hydrate well and do not massage, do not try self-remedies, do not self-medicate. If the pain has not settled, then do not delay seeking advice from an expert. Go to your closest vascular surgeon, and if there is no vascular surgeon, then the closest expert consultant who is available, and get an official opinion about what further needs to be done, what investigations and what imaging.
Right.
So important thing is to hydrate and not to delay treatment.
I think the emphasis throughout this podcast was on hydration and how we should maintain a level of hydration in order to avoid DVT from happening. Now, as we know, most of our jobs require us to be seated for a long time or either standing for a long time. So, and most of them have almost very less or zero mobility or physical activity. So in this modern scenario and sedentary lifestyle, Dr. Kamerkar, what preventive measures can we take in order to prevent DVT?
Taking cue from what Dr. Nupur mentioned, one more thing what we have seen observation is that during winter time people tend to drink less water. Many of the people here now are working in an AC environment, and that makes a dehydration, and because of air condition, we have seen more DVTs during winter time. So it's extremely important that hydration during winter time, you have to make sure it's good hydration.
Right.
And as far as your preventive measures, now again, we have seen many deep vein thrombosis. In fact, I would say it's an occupational hazard of people who are working in IT sector or IT industry, because they sit in front of computer for hours and hours, to an extent to sometimes to 10 to 12 hours at stretch.
That's true.
Without doing any leg exercise or even stretching, not getting up. Again, they are in an AC environment. Again, they tend to drink less water. And again, because of poorer lifestyle, dietary preferences, many of these patients who are working in IT industry, we have seen developing acute deep vein thrombosis. So it's extremely important for especially people who are doing a sitting job, should get up every 2 hourly to stretch their legs, have a good circulation into the legs, drink water every now and then, every hourly or 2 hourly, so keep the good hydration. And the circulation to the legs is important. Now, there are some devices probably which are available on Amazon or something like that, which when you are sitting, you do up and down kind of toe
Like a
exercise, like a pedal. So even if they are sitting, but preferably why use a machine when you can do naturally? And I think it's a good message to people working in IT, including seniors and juniors, so that they can get up every 2 hourly and stretch their legs for 5-10 minutes and then get back to your desk. So these are the mainly preventive, especially for IT people. But by and large, somebody undergoing fractures or somebody has had a fractures, they should get preventive blood thinning injections or tablets to prevent any clots. So people who are at high risk to develop acute deep vein thrombosis, like patients who have had a major surgery, who have to stay in the bed for a longer period of time, people who have the fracture when the plaster cast, or patients in ICU setup or with cardiac failure or paraplegics, when your risk factor for developing acute deep vein thrombosis is high, these are the patients should get prophylactic or preventive blood thinning, either injections or tablets.
Right.
This way you can prevent deep vein thrombosis even though you are when you are in the hospital.
Right. So now I think by what you said, most of the IT people should visit a vascular surgeon just to get an idea of where they're at and how they can prevent. Basically from this podcast, they'll get more information, but I think it's important to also be aware of the symptoms and what's happening. And if in case it's happening to your body, to your legs, it's important you visit a vascular surgeon.
Yeah.
So this has been an extremely insightful discussion, but before we wrap, would you like to give some key messages or takeaway messages for our viewers regarding prevention of DVT?
As I mentioned, for people, a good hydration is the key. Number two, get your legs moving every now and then to prevent any sluggishness of circulation. Other than that, somebody who basically needs to stay in the hospital beds for a longer period of time, one should think of giving a prophylactic injections. And many times we have seen in the hospital setups that somebody gets a fracture, young guys developing fractures and then suddenly dropping dead. And these are the patients who develop acute deep vein thrombosis and pulmonary embolism. So these are the things which are very important. Change in your lifestyle, get more mobile is the key.
Get those legs moving, basically.
Yes.
So there is one more segment of population who sit for quite a long, and lately we have realized that the very young people of around 16, 18 who are preparing for their entrances, IITs, NEET, PGs, they also sit for quite a long duration, and suddenly the nutrition is also poor wherever they are staying, focused in study. But because of this continuous sitting posture, they are also at very high risk of developing thrombosis. So such population should also hydrate themselves, move around in an hour, and keep a healthy lifestyle, have a good nutrition.
Yeah, so to add to this discussion, we have a couple of more points. People who have a long history of standing at work or sitting at work are also at risk to develop varicose veins. Now, these varicose veins now put you at a 10% higher risk than the rest of the population to develop clots.
Correct.
So, if patients who have such jobs which require you to stand for long hours, and if you've noticed bulging veins, then again you need to consult a vascular surgeon. Then the other subgroup, which I had already mentioned before, is the ladies. So if there is a history of clotting disorders, especially on the maternal side, then if you're going in for any of the specialty fertility treatments or hormonal treatments or IVF, then I would suggest that you get a preemptive assessment by the vascular surgeon about your clotting risk and versus the other complications associated with the IVF. And so that is one group. And also ladies for whom if there's a history of clotting disorders in the family, then when you choose your oral contraceptives or other contraceptives, also better to get an expert opinion involved in this.
Okay, so thank you so much for sharing these points. I think it's extremely important that our viewers can stay alert and aware about the symptoms and when they should consult a vascular surgeon. This has been an extremely insightful discussion.
I think in short, I would cover the entire journey of diagnosis of deep vein thrombosis in India for last, I would say, 30-35 years. At one point of time, it was considered that deep vein thrombosis is a myth in India. Indians do not get deep vein thrombosis, and it has proven to be so wrong in so many years.
Right.
In fact, we have equal incidence of deep vein thrombosis as is in Western countries. And if I look at the journey of treatment in acute deep vein thrombosis, it started with low molecular weight heparins as a treatment. Then it went on to giving low molecular weight heparin for prophylaxis or prevention of acute deep vein thrombosis. And now we have come to new oral anticoagulants or new oral blood thinning tablets for treatment as well as for prevention of deep vein thrombosis. And when we look at the prophylaxis of deep vein thrombosis, one of the key subsegment of the patients, what we see are the patients with joint replacement therapy, like a total hip replacement, total knee replacement.
Right.
These are the patients are very prone to develop acute deep vein thrombosis because many of these surgeries are done under tourniquet and generally in an AC environment with a poorer hydration during anesthesia, and since these surgeries are done on the legs, the venous circulation becomes sluggish, and because of tourniquet it makes it worse, and these are the patients who are more prone to develop post-operative or after surgery deep vein thrombosis. And that is why prophylaxis or prevention of acute deep vein thrombosis following total knee replacement or hip replacement or major fracture surgery is important. It's equally basically looked at today, of course, in all cancer therapy treatment as well as, but again, a prophylaxis is also considered in bariatric surgeries in today's day and age, where many of these patients, obese patients, undergoing bariatric surgeries, and these are the patients are more prone to develop post-operative acute deep vein thrombosis. So these factors have to be considered today, and I'm sure as we go along, it will be more and more new molecules would come. But today, what was basically given as injectable form now we moved on completely to or almost 90% to oral anticoagulations because of new molecules which have come as developed, like rivaroxaban or like apixaban. Edoxaban now also is available in the country, and I'm sure the new molecules also would come. But it's equal. What is important message? Diagnose your acute deep vein thrombosis in time and treat them right away. Now, one of the things what we have seen in a clinical practice that they are put on oral anticoagulation, but the dosages are never right dosages.
Okay.
So when I tell my juniors that how to treat our acute deep vein thrombosis, this should be right diagnosis, right drug, right duration, and right dosages.
Oh, I think that sums up.
So if none of this is right, your treatment of acute deep vein thrombosis is going to be totally inadequate. That's going to cause many times fatalities. That is going to cause chronicity of the problems with many leg problems in future for these patients. So all these right things must be considered when you are treating acute deep vein thrombosis. Right drug, right dosage, right duration.
Right.
These are the three right things. Because if the even dosages are not right, the treatment becomes inadequate.
Right. I think this is one of the biggest takeaways for our viewers, to consult a vascular surgeon for DVT. And if you're confused about anything, you can always consult and go back to this podcast if you have any queries also.
So this month itself is a worldwide DVT day. In fact, 8th of March is considered as a DVT day. So it would be a good period to get this awareness for acute deep vein thrombosis across the people in the country.
Thank you so much, doctors. This has been an extremely insightful discussion. And to our viewers, I'm sure you found this podcast helpful. And if you think this can help someone that you know, kindly share this with them. And let's spread awareness about DVT and pulmonary embolism. Stay safe and take care.